guys, I'm Dr. Winston, and this is my lovely office assistant slash sister, Monica.
Hello.
And she is getting an Ozone IV today for immune support because she is about to go on vacation. So this is something that I always do for myself to protect my immune system whenever I'm going to travel. And it's something that I recommended she do, and also because she's been kind of fighting a little bit of a virus that went through basically our whole family. My toddler brought it home a couple weeks ago. So her immune system is already just slightly burdened right now, so I don't want to send her out on a plane, not feeling 100%. So we're doing an Ozone IV. This is also formally known as Major Auto Hemotherapy. And basically what it is, I'm taking her blood out, I'm gonna mix it with some ozone gas, and then I'm gonna give it back to her. And what that does, when the ozone touches any sort of moisture, it splits and it generates both oxygen and peroxides. And both of those things are very important to our cellular function. So we all kind of understand what oxygen does. It basically helps the cells do what they're supposed to do on a daily basis. So it helps you create energy, it helps you detoxify. It helps with muscle recovery with exercise, helps clear out lactic acid that's building up. So that excess oxygen that you're getting is super important. And in athletics, this is actually known as blood doping. So you might have heard of it that way. So obviously this is a very low dose. I think athletes are allowed to do something like 50 mLs. We're doing 200 mLs today, so it's a little bit more than any Olympic athlete would be allowed to do. But for those who aren't in professional level sports, this is a great recovery for muscle fatigue if you're going through some sort of training, etc. And the other part of it is the peroxides. So the peroxides are really cool, and every cell in your body actually generates its own peroxides as part of your natural immune function. And these peroxides act as signaling factors to modulate different inflammatory molecules and immune molecules within your system. So I use ozone in people who are chronically ill with chronic infections, so viruses, Lyme disease, and co-infections like Babesia and Bartonella, C. pneumonia, Mycoplasma pneumonia, etc. There's a whole host of them. This is also excellent in traumatic brain injury. It can be really helpful to reduce inflammation that builds up in the brain due to trauma. And then we also use it for healing any sort of acute trauma. So as long as you're not having an active bleed or hemorrhage, this is totally safe. And the reason why we wouldn't do it in active bleed or hemorrhage is because we have to administer heparin with it so that the blood, while it's in the bag out of the body, it doesn't clot. And so we obviously can't give someone heparin if they have an active hemorrhage, but that's really the only contraindication for this therapy. Otherwise, it's pretty awesome for everybody, and it can really be used for anything from healing acute illness to anti-aging therapies. So now the reason I have Monica on here today is to basically ask me questions, because I know that you have questions, and I work with this therapy all the time. So any questions that I have, I don't know what you want to know. So I wanted to open it up to her to ask me some general questions. And then if if you're watching this video, go ahead and drop me any extra questions in the DM or comment below. And I can always address them more directly there, or I can do a follow-up segment to this later on as well. So do you have any specific questions, or do you want to just talk about your experience so far?
Well, something you just mentioned about the TBIs, traumatic brain injuries. Is it something that you can do well after the fact that that's happened, or does it have to be right away after something has happened?
Yeah, that's a good question. Okay, so in TBI, it's generally a therapy that we're going to use pretty far after. It's not that I wouldn't do it right away. If I was confident that there wasn't any bleeding in the brain, I would feel confident doing it 24 or 48 hours after the traumatic brain injury. But I wouldn't do it any earlier than that, simply because if there was a bleed, we wouldn't want to open that up and create more issues. But for old traumatic brain injury, so if somebody had concussions in sports as a kid or even in college, or if somebody got in a motorcycle accident or a car accident, a year ago or something, this is something that could definitely help clear out some of that residual concussive type symptoms that we see that can linger.
Interesting. Okay.
Yeah.
Well, I guess this is my third
Ozone treatment.
Yeah. That's the word I'm looking for. So I'm getting a little bit used to it. I guess when I first started out, I had several questions, as in, is it painful? And it's not. It's just like getting your blood drawn, one little stick of the needle, and then things get going. And you just sit here and your blood drains out into your bag, and then all of a sudden it starts coming back to you. So it's not painful. The very first time I went through it, it was very exhausting. I went home and went to bed. So I was very tired afterwards. The second time I had it done, I was still tired, but not quite as bad. So I'm hoping this time, now we'll get to the point where I'm getting energy as I'm going to Nashville and I need lots.
Yes. Okay, so that's actually an excellent point. Your first several treatments, the way you react to it actually depends on your system and why we're using this. So what Monica experienced is what I would call a detox reaction. So on her first treatment, she had kind of a dumping of excess toxins that had been accumulated in her system, and that is why she felt fatigue and sort of achy and a little bit of those really mild flu-like symptoms. So in my experience, that's actually a good thing, because it means that the body is starting to let go of some of those toxins that have accumulated. And that's a very typical reaction for the first, I would say 1 to 5 treatments. And like she said, with every one, it should be less and less and less intense until we get to the point where the switch actually flips. And when that happens, it's usually around IV, it depends on the person, but usually between IV number 3 and number 6, something switches and the person actually will get a boost of energy and they'll feel great afterwards. And when that happens, those people are the ones that always come back to my office asking, how often can we do this? When can we do the next one? I want to do this every day. Can we do more than one in a day? And so I always have to kind of encourage people to get to that point, because sometimes it's hard to do a therapy when it actually makes you feel a little bit worse, because it's hard to understand that it's actually helping, even though sometimes it feels like it's not helping.
Yeah.
So yeah, those are great observations, great questions.
And it didn't last. I mean, I literally went home, and that day, the rest of the day, that night, I was completely exhausted. But by the time I woke up in the morning, I was feeling normal again. So it's not something that lasted, the flu-like symptoms, for an extended period of time.
Yep, that was just her body recovering. Totally normal, and it's different for everybody. I have had people feel amazing after the very first treatment, so it just kind of depends on your body and what we're using it for. If you're acutely ill, if it's a past injury, if we're doing this for chronic infection, if we're doing this for detox. So one of my favorite uses of this therapy is actually for mold detox. I have been talking quite a bit about mold detox, and I'll continue to talk about it. We're starting to get into the warmer months where we're going to see less mold illness, but it doesn't mean it's gone. For the 25% of the population that can't detox mold, it's stuck in your system forever unless you do something actively to pull it out, and ozone therapy is an excellent way to start pulling it out. So any last questions from you?
Maybe just one more thing. Time-wise, how long does this take? So if somebody wanted to come in and they needed to have some idea of how long they would be here.
Yeah, so great question. Typically, I say about 45 minutes. For your first treatment, typically we do not do the full treatment. I usually do a trial dose, which is about 50 to 100 mLs, and that one only takes about 30 minutes. It really depends on how good your veins are and how quickly you bleed. So that's, it really is. Some people have really tiny little veins or stingy veins that don't want to let go. Monica has great veins, so she goes pretty fast, which is partly why I need to wrap this video up, because I need to check her bag. But yeah, I would say I usually tell people plan 45 minutes to an hour for a full treatment, and then, if we do any extra nutrients or anything on top, we obviously add that time on. But yeah, good question. It's pretty quick.
Excellent. Thank you for having me.
Hey, bye.